Now, unfortunately, diabetes needs a lot more thinking about if any of us come down with any kind of sickness or illness. And by sickness or illness, I mean anything from a heavy cold to a serious bout of the flu or a bad chest infection or diarrhea and vomiting or anything like that. When bugs and viruses invade our body, they stay and they reproduce because we provide them with ideal conditions. We are nice and warm and moist, and they like that. They stay even longer and they do even better if you feed them. And that's exactly what's happening in diabetes when blood sugar levels are a bit too high. So if anybody with diabetes develops an infection or becomes sick with a virus, then they are more likely to be much sicker much sooner than somebody without diabetes. And for that reason, we need to be very vigilant about our diabetes management and to seek medical attention as soon as you think there's anything the matter. Nearly in every single case, your blood sugar levels will always go up when you have an illness. What's happening is that when we become ill like that, our body produces extra hormones and extra steroids, and it's the steroids in particular that push the blood sugars up. So blood sugars will nearly always go up in the case of any illness in diabetes. If you are doing any monitoring, you must monitor more closely with your diabetes so you can identify whether your blood sugar is climbing or stabilising. And one of the golden rules with diabetes and being ill is that you must never stop your medication, even if you have no appetite and you're not eating. It would be a very logical thing to think that because I haven't eaten any food for 3 days because I feel horrible, I don't need my medication. That is very logical. However, because of what I've just said about these additional steroids that are circulating in the bloodstream, your blood sugars will always be going up anyway. So you will need your medication to combat this rise in blood sugar even without you eating any food. Same applies for anybody who's using insulin. You must never stop your insulin, and indeed those people who are taking insulin may have to administer up to twice as much insulin as they otherwise would in order to gain control of the blood sugars. It's very important to seek prompt medical attention as soon as you can, because we need to try and tackle the virus or the infection as soon as possible, because if we don't and we allow it to go on and develop for a few days, the blood sugars will rise, and the richer the sugar supply in the bloodstream, the longer the bacteria will stay, the more they will multiply. So we get into this vicious cycle of a spiral of things getting out of control. So more vigilance with monitoring your diabetes and prompt medical attention are very important, along with never stopping your diabetes medication. If you're feeling rubbish and feeling really poorly, have no appetite, it's still quite important to try and take some food or fluids that have got some calories in them, just to give your body a little bit of fuel. So good fluids would be things like milky drinks, like milky coffee or milky cocoa, or some nice homemade soups. Any drinks that you make with milk. If you do like that sort of thing sweetened, then obviously add an artificial sweetener without not putting sugar in it, and definitely avoid things like Horlicks and Build Up and Ovaltine and drinking chocolate, because those drinks all are very, very high in sugar, whereas simple cocoa or coffee doesn't have any in it. Additional protection that is a really, really good idea and well worth thinking about is for you to enable yourself to have the flu vaccine every year, and also the pneumonia vaccine, which is also available once every 10 years. Both flu and pneumonia can be really devastating and knock you off your perch for several months, and it's well worth having that additional protection. People with diabetes are in the identified group as being recommended to have these flu vaccines and the pneumonia vaccine. So I recommend that you present yourself at the surgery next winter and ask if you can have an appointment for your flu and your pneumonia vaccine.